And a big joint announcement from Truman Medical Centers and Cerner this week.
They have developed some new software to help doctors and nurses potentially save people from becoming opioid addicts. Fox 4's Rebecca Gannon joins us now live with the details. New at 10.
Good evening, guys. A few years ago, Cerner came up with similar software to combat sepsis, which is a potentially fatal blood infection. Cerner estimates that technology has saved about 15,000 lives, and the company gave it away for free. Now it wants to do the same thing with this new software to save people from opioid addiction.
I think we want to do our part. I think that everyone understands that this is a real big problem, and what can we do to help with the solution?
Joanne Hatfield is not your typical pharmacist. You can often find her at bedsides of patients at Truman Medical Center's pain management clinic.
When we saw the opportunity to involve pharmacists within pain management, it really hit home.
For the last 2 years, she's been heavily involved in her computer.
I reviewed a lot of patient profiles,
helping figure out a way to curb the opioid epidemic.
How many high-risk opioid medications are there?
Probably more than I can count.
This week, that began to change, thanks to that computer and Cerner.
I think that in the beginning, I was doing a lot of this work on my own, not knowing what else was available to us, and so this will be a very valuable tool and also a time saver.
The electronic health record company announced it and Truman Medical Centers developed software that doctors can use anywhere, even from the hospital room. It will let them know when a patient already has prescribed opioids, if that patient should get any more, and lets the doctor check statewide drug databases to see if the patient is doctor hopping, all because of Hatfield.
We can utilize the tools to use her brain throughout the day, 24 hours a day, 7 days a week, 365 days a year. Not only can we do that here, but as they roll this out to all of their clients, it will touch across the country.
So what started with one computer could curb the tidal wave of pills consumed in America and save lives and families across the country.
I think this is extremely exciting.
Now, Truman told me that in the last year, it's been able to use its program to reduce its IV opioid use by more than 12%. Now, that translates into 10 fewer patients every day than this time last year using opioids. And if you multiply that out by all the health systems using Cerner, that could be a game changer for many families.